We are here live in Minneapolis, Minnesota, and I am here with Stacey Hardin, and it is so good to catch up with you and have you come down to the hotel.
Yeah, thanks for having me here. It's great.
I mean, Minneapolis has been good, but the weather hasn't been too bad the last few days, so it's been a nice surprise traveling here.
Yeah, 60s in November. A little bit of rain, but that's as good as it gets for sure.
We lucked out in Philly a few days ago. We had a little bit warmer weather, so that was a nice little change up too. But y'all are kind of starting to go on the cold route for us.
Yeah, it's good for you guys from Arizona to feel a little of the cold too.
Yeah, a little bit of a change. I feel like we know each other pretty well because we went to some parts of the world, the country together. I'm from Rhode Island, and I saw that you went to school at Boston University.
I did, yeah.
How was your time in Boston?
It was cool. It's a really cool city. I'm from Northern California, and I wanted to try something different, and so going to the other side of the country was that. I think it's a really neat city, especially for somebody, early on in their career and going through schooling because there are so many schools, young professionals, sports teams. So a really dynamic, fun city.
What do you miss most about Boston?
I miss the attitudes a little bit.
So you miss the masshole, what they tell me. You miss that masshole.
There's a certain edge that is right between like mean, but also like tough love that you don't feel in Minneapolis. And then you can't beat living on the water, and it's so nice.
Where do you live in the city?
I was at the Fenway area the majority of the time. So, I could see my first apartment, could see Fenway. You can hear it, you can feel the buzz. You walk out into it and just kind of have to pinch yourself because it's pretty special.
It's a great city. I miss the cannoli.
Yeah.
It's hard to find good cannolis outside of New England.
Yeah, interesting.
Very so. I haven't found mine in Arizona yet.
Sure. Did you get into baking during the pandemic at all?
No, you know what? Everything was sold out.
Oh, good point. Yeah.
Nothing was in the aisle, so we just said, no ways. We just, whenever we travel to the cities, found my cannoli.
Yeah.
And good to go.
Yeah.
Brings a little bit of Boston back for me.
Perfect.
How'd you go from Boston to here?
I went Boston to here via one of my colleagues who's in MLS now. So he was with the Revolution at the time in New England, Boston area when I was in Boston at BU. And we had known each other for a while. And he said, hey, I know this is your professional goal to work in Major League Soccer. I think I'm going to come out to Minnesota. Would you want to come too? And I said, sure. And then came out here without ever visiting, had virtual interviews and said, let's do it.
Was it cool?
Yep. I don't know if you want me to drop names.
Yeah, they just won the title too with LA.
I know. And Coop is all weaved around Coop. Like, him and then people like Theron Inns who have been in the league for a while. They've got such a hold with everybody in the league.
Well, man, it's a small world. It really is.
Yeah.
So then with Minnesota, where has your role evolved from there? Because I know you've had a couple different roles in certain spaces. Like, how have you gotten to where you are right now?
Yeah, it's a good question. I started under Sean as an assistant athletic trainer and physical therapist. That was the first year. The team was an expansion team, and so there was a lot of need and a lot of growth over a very short period of time. So kind of switched from that kind of beginning role all the way up to the senior director of player health and performance as we expanded the staff and as we got bigger and better as a club. And then kind of similar to a lot of people at the end of 2020 after the pandemic, I was tired and I missed my family a lot. And I said, there are a lot of things that I feel like I missed. And without being able to fly, it got harder. And so I said, I want to take a step back from that full-time, relocated back to California and was, really lucky enough that the club was open to me working remotely and helping them kind of guide into their next group of staff.
And so are you back with the team right now, or are you still working from a remote role?
So I work as a mainly remote, but since I am actually back in the cities, then I'll see some of the players in person. But the role is set up where it can be remote if need be.
And so then So did you transition from working outpatient before you got into Minnesota? Is that fair?
I started outpatient private here.
Okay.
So for the year in 21, I was just in California, just doing the remote Minnesota United. And then in 22, I moved back here and started doing private outpatient performance and rehab. and continued with the Minnesota United role.
Gotcha. And so imagine in soccer, some of the common injuries you probably saw were hamstrings, hips, groins, right? Like in basketball, we see ankles, knees, little backs, right? It sounds like you have a little interest from some of the research you do and also experience that you have with hip and groin. So I'm excited to dive back into this because I don't see this anymore. I really don't see too much of those types of injuries in my space. So from like a 10,000 foot view, what would you say is your approach or things we should be looking at considering hip and groin injuries?
Yeah, I do love the hip and groin, so I'm glad that you picked up on that right away. I think it's just such a reasonable joint space. No offense to the shoulder people, and I don't know if you're a shoulder person, but like the shoulder, I just sit there, I'm like, that doesn't even make sense. Like, it doesn't even go together. They're like, oh, it's like a pseudo ball and socket. And I'm like, no, the hip is a ball and socket. It goes together. You have these nice structural supports. You have big muscles around there that help to stabilize. And then you get to the shoulder and you're like, what is going on? This just doesn't seem right. So I do love the hip and shoulder, or not the shoulder, the hip and groin. Specific to, what do we look for? What are we interested in? First thing I would say is we need to keep people moving. I think across the board as rehab professionals, we don't do a good enough job of keeping people as close to active and doing as much as they can, regardless of their injury. Obviously, there's a time and a place and when that's appropriate and when it's not, but I think we have really compelling evidence now to say that you can't just completely shut people down.
What would be some of that evidence that you're referring to?
So, well, I think a lot of the kind of loading literature, if you look at like the Tim Gabbett and all of those folks who look at any type of loading, it says when we have big spikes, so big peaks, big valleys, our body doesn't like that. But I think you can extrapolate and use those principles in the rehab world. And it may be something that we say, hey, we know you're not going to be running right now, but can we keep your total distance of walking the same? And that way, that's a smaller jump for your body when you go back into those harder activities.
That makes a lot of sense. And I agree with rest is not the answer. Right? Like Billy said, there's a time and place, typically right when injury happens, or hey, there's some head surgery, right? That's one that comes to mind. Probably need to just chill out for a little bit. So now if we dive a little bit deeper on this, right, we go from we zoomed out 10,000 foot view, we zoom in from, let's say, initial injury to, let's use soccer. Right?
Appreciate that.
They go back to playing. We'll say pitch. We still saying pitch in soccer?
We'll say, pitch, field, place, or whatever you want.
Okay, so choose your buzzword from injury to buzzword. Where are you taking it?
Yeah, I think, the movement is first. Knowing the anatomy and the injury and kind of what that all entails is really important because there's a lot that you can do. So if you take something like a groin strain, pretty classic with soccer players, say it's the anterior portion of the adductor magnus versus the posterior portion. Anterior portion biases flexion, adduction a little bit more. Posterior portion is extension, adduction. So we can take those little nuances and then build our programs around that and build especially movements around that too. So you can have somebody who has an adductor injury who said, maybe we're just doing a ton of linear work with them, but move is kind of my underlying principle.
So if we break it down like guiding principles, right? From a movement side, if they're having pain, is it walking is our first thing to going? And then you're looking for, hey, I want to see what you can do in soccer. Can you do maybe some simple ballage or passing? Do you kind of have a progression of movement that you'd like to see as you're working through their symptoms and clinical exam as well?
Yeah, absolutely. I think you hit the nail on the head with kind of that criteria. It's a criteria-based progression. Can you do these things in this order to know that we're going to be successful? And how I explain it to athletes is, we have a staircase. You can choose if you want. Are we going to walk up that staircase one at a time? That's doing things like linear running, predictable change of direction, then going into, that's a big jump. Or do we just say, hey, you feel good, look good, and then you're jumping up the staircase and hoping that you're going to land. So I much prefer to walk up the staircase one step at a time. So, if we're talking specifically about a groin, what are we doing linearly first? How do we then transition that into something that's more lateral? How do we work in things that are predictable versus unpredictable, especially with change of direction? and then putting all those together through high force environments. So something like a very quick, unpredictable change of direction or striking the ball really hard, depending on their position.
Gosh, now are there, like in your experience with soccer and then diving down into the research and the interest within this, let's say, injury category, are there certain common pitfalls that you see in our industry that we make or assume based on either prior literature or just maybe we're just not there yet or caught up with the research? Do anything come to mind?
Yeah. I think people just aren't getting strong enough. We're not doing a good enough job of getting athletes, and particularly, I think at every level, but also in the pro space, which surprised me because I always thought like, oh, pro athletes, they're all very, very strong. They're not. We're not doing a good enough job getting them strong enough to prepare them to withstand the demands of their sports.
Okay. So then do you think, do you think there is like something as an industry that we need to, beyond the strength side, is there something that we can like all upgrade what we do to kind of push the needle forward in the context of prevention of groin, prevention of hip injuries, or even progressing our rehab protocols loosely here?
Sure.
Is there anything that comes to mind?
That's a really good question. Because I think it depends kind of on the individual that are working together. And specifically kind of that interplay between strength and conditioning and what folks are doing between those spaces and within those spaces. But I think making sure that, like our programming is appropriate is a good place to start. Making sure we're actually measuring folks and saying, okay, how strong are these people, and measuring them in positions and movements that are actually applicable to them. And then continuing to serially measure those things and saying, hey, if our goal is this for this person, and we have this program, is this working, getting the results that we're looking for? And then tying it back to the even bigger picture. What is their health status? What is their performance status then?
I love how everything is this integrative process. And I'm hearing you, like I wish people are watching this as well. Like your hands are moving, like you're getting, but if it's clear on them, but like that's the progressive model that needs to happen in our industry. Like the phrase of operating in silos or lack of communication is often a friction point for most teams, right? So you also stepped into a leadership role within the Minnesota squad as well. So how are you tying in leadership and communication into the athlete care model that you guys have?
Yeah, that's another really good question. And I think, we talk about programming first, and most athletes aren't going to know, like, oh, well, they chose 3 sets of 8 versus 4 sets of 6, 1 set of 3, and so I think it really comes down to the leadership that you or your staff have with the athlete during that process. And that one-on-one, I usually think of more as kind of a guide. And I usually use the analogy of hiking. So if I were to hike, let's say, Everest, and we'll call that like our big injury is Everest, I'm going to hire a guide who is very knowledgeable. They've done it beforehand. We're going to train. We're going to sit down. We're going to go over the expectations. And then we're going to go together, but me as the hiker or the injured person should be able to know what to expect, should be able to go through a lot of that process with the guide there. So I don't see it as I'm a leader, you're a follower. I think it's much more of a relationship that we have, and really a teamwork of people working together, including the athlete, having common goals, having common checkpoints, and knowing where we're going along the way.
The word that I'm hearing is it's a collaboration. It's a collaboration. It's more of a team effort than this is my way, we're going to go and you're going to follow me. Is that fair to say?
Completely fair.
So how would you define leadership then within your framework?
How would I define leadership? I guess for me, it's the ability to elevate the people who are around you, elevate us together. And then usually within the context of, a sports team or an organization towards kind of a common, mission or vision that we have that we're trying. But it's all of us coming together and really highlighting and kind of celebrating all of the things that individually we're really good at, really capable of doing.
Like, do you have favorite leaders that you try to aspire to? Like political figures, powerful people in high places? Is there anyone past, dead, or present? Anybody come to mind?
That is such a good question. Um, I don't know. I think Nelson Mandela, I've always been really impressed by him. I think there's a lot more obviously to his story and circumstance than anything that I've experienced in my life, but quite impressed by him. I think recently, kind of some of the folks in the women's coaching leadership space have been really impressive. Becky Hammond to say, hey, I'm going to do these things. I'm not going to apologize for who I am, but I am also very professional and I am very capable and strong, has been really inspiring. I think there are a lot of great leaders, and with social media too, you get to see a lot more of the good.
When you mentioned Becky Hammond, which brings me to a point I wanted to talk to you about, is because women in pro sports, we're starting to see that be more and more common, which unfortunately it wasn't the norm years ago. So for you yourself, how is that experience being a woman and a predominantly male staff sport, not only the players, but also the staff in soccer, especially MLS? What has that journey been like for you?
Yeah, I think up until this point, I've largely worked in male sports, so it's just been something I've been more integrated in. Like internally within Minnesota United, they've been quite accepting of that. Externally, I think there's always some confusion, say, when we're on the field as a group. I would say the vast majority of times, like the referee for our pregame meeting will go up to my male colleagues who are also on the field, and they're like, oh, wait, like, she's the one who's in charge here. And that comes from, what their experience has been in the past. But largely as people, I've introduced and we've gotten to know each other, they've had no problem saying, oh, great, nice to meet you, and then moving on from that.
I would imagine it's going to be frustrating. Like if you're the person that is the leader of the group, but still not getting the acknowledgement or recognition on the field, is that a point of contention for you at all? Did you ever feel frustrated in those moments?
Not really. I think because the staff who I worked with were wonderful and I trust them and they're very capable. And they're just very good people. And so for me to say, okay, this person is acting this way because this is the only thing they've known or ever experienced. I would expect that. Now, if that same person continued to do the same thing over and over again, then I would probably say, like, all right, what's going on here? But, there's situations a lot of folks, and these older men especially, have not been in. So I think they deserve an opportunity to be educated, to learn, and to change their behavior.
Yeah, I think you said it well. Like you can't fault someone for what they don't know. We don't have the experience too. I think we've all been in those situations where may not have acted appropriately, may not have acted what's common nowadays. But I think the more exposure experience people get, hopefully we as a sports society, but also society in general, have a chance to grow and be more accepting of those of life in yourselves in those positions. I think it's wonderful. How would you, right? You alluded to Becky Hammond earlier as well, right? Like she's elevating. She is elevating women in sports amongst many other athletes and leaders. Like from your position, and you also mentioned how you're elevating the group within you as well. How do we elevate other women to be a part of sports and to take those opportunities and not be afraid?
Sure. And I think even taking a step back from that is, getting those opportunities, which is a whole different conversation. And I think we could have many, many, many podcasts on this topic. It's hard. And I don't know, I guess is probably the best answer. There are a lot of really smart people who are researching this specific to the sports space. So Cherie Becker is in the UK. She does a lot of outstanding work in the gendered environment space. So I think, first starting out and educating yourself by these folks who are spending a lot of time and their entire career and their passion of really studying the gendered environment in sports, and then asking the questions. So even something, it seems simple, but it can be really hard to do. I have a lot of respect for you for even asking questions like that. And just, starting to talk about it and making smaller changes. Cherie, in a lecture that I attended of hers last year, she said, hey, something really small that you can do is if you have plaques outside restrooms that say male and female, you can take those down, replace them, and it just says restroom. And that really struck me because I think sometimes I'm guilty of, oh, I don't have this big plan or this big answer or this big process to go through, so I'm not going to do anything. But especially in this space, I think small steps and small changes really do make a big difference, and we've got to start doing something.
Yeah, absolutely right. I've started to notice that a lot more. Those little things. It's funny you bring up the restroom side because the restaurant we were at last night literally just had the same exact thing. It's just restroom. It doesn't even say men, women. It is the picture. It's just restroom, right? So something as simple as that is like I think subconsciously is going to do small steps forward, like you alluded to. Imagine I was a woman, not a male, and I was trying to get into sports, and I was trying to find my way. And if I'm maybe I'm not there yet, or I am there yet, but I'm having some struggles, what advice would you give?
I guess figure out your why. And that probably is regardless of gender, but what is your why? Why do you want to be doing this? Why do you want to be in this role? Why do you want to be in this type of environment? Figure out what that type of environment, what those values are of people you want to be around, of an organization that you want to be around, and then see if you can find a way to match those two. For some folks, it is like, hey, I just really want to work in pro sports. So you've got a lot more opportunity there, but there are a lot of sacrifices working in pro sports that you have to make. So I would encourage people to really understand why they want to be working in those type of environments and what their expectations are when they're working there.
Do you have a why for yourself?
Oh, I knew you're too good with the questions. I mean, my why ultimately is to help people. I like people, which sounds really silly. And I think that in a position to help people feel better, especially, and function better, I think it's a privilege to be able to do that.
I think so too.
Yeah.
I think that's probably why we all, at some level, I would hope, get into the profession of healthcare, whether that's coaching or on the medical side, or the government side. I think we're all just trying to, someone once said, I think we're all like that shining knight on a white horse, just riding and trying to help and save everybody. I heard that analogy, and that's pretty true to a lot of us that work in this space.
Yeah.
Like you alluded to your why, and it's great advice. I think that's phenomenal. Even just like a reminder, if we lose our way as far as why am I doing this? Why am I here? Like today's a down day for me. Let me just remind myself what that why is. Have you ever been in a situation where you've lost your way and you've had some struggles being in pro sports? Because it can be, like you said, it's chaotic. The schedule can be brutal at times. How did you manage that situation for yourself?
Yeah, I think I've been in that exact situation. After 2020, 42 days in the bubble, a healthcare provider during pandemic. I mean, you can talk about that any way you want. But I had to take a step back, and I had to take a step back and really ask myself, why am I doing this? What is important to me? And then give myself permission to say any things that were important to me during a period of my life are important to me in a different way now, or I want to prioritize different things. And just because you change or shift what you're doing, it's not as polarizing, I think, as sometimes we think it is. Like, oh, I'll never do this again, or I'll never go here, or this door is shut, or these people will hate me for leaving, or, whatever we've created in our mind. But I think if you act in a way that is professional and respectful and kind, and you do that with the group of people you're with, and you do it to yourself, then the opportunities will still continue to be there.
That's really good advice. I think we can all learn from that. I think the pandemic taught a lot of us a lot about ourselves, but also the way the world works. And so with that, how was the bubble for you?
The bubble was an experience I will never forget. And I think that's what life's about, is experiences that you will not forget. You'll tell your grandkids, you'll laugh about. Even now, it hasn't been that long, you can still look back and laugh. And really, that's a bonding experience for those group of people. But it was wild, set 42 days in a hotel, a 2-mile radius that you could go around, same food, same general schedule, same activities. It was interesting.
If you could use one phrase to describe the bubble, because my wife would tell me, like, you were an adult summer camp.
Yeah.
That's what you're at. We're out there playing. Because our hotel was next to y'all's. We were at the yacht club.
Yep.
So we were not too far from you. I remember, like, actually seeing the hard line in the sand.
Yep.
don't cross that. And funny story, my second day there, they're still putting up the barriers, and I'm like, I gotta get on. Sorry, after we cleared protocol.
Sure.
Yeah, I can't say second. The second day out of protocol, which probably took 5 days. I went for a run, and I'm just like going for my loop. I'm just going, and I run. I get back to my room, and my phone starts blowing up by like unknown numbers. I'm like, what is going on? NBA had a security call me. He's like, we have to put you in quarantine. I'm like, what are you talking about? He's like, you broke the barrier. I was like, what barrier? So we ended like, long story short, we ended up figuring out like where the barrier was. They hadn't put it up yet. So I like run towards your hotel, and I'm like, this seems really eerie. I should probably get out of here. So I turn around and go, and then sure enough, like it was a big old hot ordeal for a good couple of hours, but they sorted it out, and it was. But it's right, like you're like, oh, like you're kind of confined to this space. It was really like so surreal. So like, how would you have described like in a phrase to what the bubble was like?
I think it reminded me of college without the kind of youthful freedom and liberties that come with it being in college. Like, you weren't out partying, you weren't drinking, you weren't running around with people, but it felt dormy in the sense that you were in hotels and you had like very specific structured things that you had to do. And then it felt like, I don't know if this was your experience too, but it felt like a casino also, because people were coming back after midnight and they were having post-match meals, and then you had folks who were up at 4 getting ready for pre-game meals because all the games were continually going. So you could have people just kind of floating through different meals at, midnight, at 4 a.m. in the middle of the day.
I had no idea that was the case. I
Really?
I remember watching games and her being in my room, and it was like 9 o'clock, 10 o'clock, there's a kickoff going on. I had no idea they were like crack of dawn as well.
Yeah.
It was the only way to get games in, huh?
Yep.
Wow.
Yep.
That must be great for sleep performance,
right? Right. We're going to keep you on a consistent schedule. Yeah. Well, what are your sleep numbers? Oh, 2.5 today? Like, I could tell why. And then all the weather delays too. Outdoor sport problems, I suppose. I think you're playing when they tell you you're going to play.
Yeah, but the thing I miss about professional soccer is being outside. Like we are inside 20, like a lot of hours of the day here in basketball.
Yeah.
So I definitely am envious of that when you guys are in MLS. If you had the bubble and like, oh, you guys are going to play outside, not play inside like we were.
Yep.
Did you guys like have any like team activities that you guys are doing as a team, like with the staff, like anything fun that y'all were doing?
We were pretty good with the workouts, which was really fun. The gyms were really nice that they made down there. I mean, very well equipped, big spaces, great equipment. We also made some tennis nets out of cardboard boxes. There were some pictures that were on social media. So we were playing soccer tennis, which was really fun too. Just to see how creative people could get with limited resources. And, a space, a room like this that you have to stay in was pretty fun.
Yeah. So I would imagine that must be just like one of the silver linings of the bubble was, oh, you know what? We made our cardboard tennis.
Yeah, absolutely. And like you can do so much with so little. There were folks on other teams who had remote control cars who were setting up, remote control car courses out, in the courtyard area. Just little things you probably would never do if you were, at your home market or, with your friends or family. But it was really fun.
You guys had, I think you guys had a little bit more fun. Not sure about that a lot. It's not like I would have loved to do like some RC car racing.
I know.
About it. That's not a lot of fun. I haven't done that since I was a kid.
Yeah, exactly.
Let's bring it back here to what we do professionally.
Sure.
We're having a lot of personal banter here, which I'm enjoying thoroughly. When it comes to rehab and it comes to performance training, even just the season as a whole, wins and losses, ups and downs. Like one phrase I find myself saying a lot is like, hey, we just gotta find our win for today. Like how you in the context of rehab, and let's just say rehab, how are you helping your athletes find small wins?
That's a really good point. I think athletes are used to operating at such a high physical level that when they become injured, all of a sudden they're like, oh, I can't dunk, I can't sprint, I can't this, I can't that. And there's a lot of I can'ts. But we really need to be those people who highlight the I can'ts for them and kind of not reset their expectations, but give them context around what they're doing now. So it's like, hey, now you're walking and you were putting all of your body weight on that, which was a huge deal because for this reason. So really being that person who can pick those things and provide that context. Also, trying to make things objective, I think, is really helpful for athletes because most of them are very ambitious and goal driven. So if we can say, hey, like you did this X yesterday, you did this X today, this is greater than this, like that's a win, that is progress, and show that to them.
Like, how would you, is there like a phrase that comes to mind, like how do you define a small win? Like if a guy says, hey, like, I hear you keep saying, hey, we got to find our wins for today. Like, how would you define that for them or put it in a different phrase?
Maybe anything that just brings them joy or happiness or just a smile. And for me, it doesn't really matter if it's necessarily related to the rehab process or not. Like, I would like that to be and to get to that space. But for some people, the first step is being like, oh, I'm going to be happy today, or this portion I am going to find joy in. And then that's going to trickle into the rehab space. But we can't expect these guys to live in isolation either between like rehab and the rest of their life. So it's like, great, I saw a really cute dog on the way over here. That brings me joy. Now I have a little bit more smile, a little bit more energy. That's, bleeding into my rehab. And now we're going to get a little bit, happier doing that too.
I love that you brought up that point because I think you're right. It bleeds into what they do, but so much more of their identity is not just the athlete. And I think the hardest thing that an athlete that goes through like a significant injury is like it's traumatic. It's called a micro trauma, small t. But they lose their identity because like they're not with their boys on the field. They're kind of in a different space at practice. Like they're usually separate from the team, right? They're kind of in isolation. So the ability to, I think, where I find success as well is pointing out the things outside that they're doing really well. It's like, hey, did you eat clean meals today? Hey, did you tell your wife that you love her today? Yeah. Did she tell you she loves you back? Yeah. Things that like bring it like bigger picture, because I think it helps them realize, you know what, like, yes, my life is in the dumps right now because I can't play the one thing that I love the most or one of the things I love the most. So helping redirect some of that to other areas of their life where they do find joy, they do find happiness, has been incredibly powerful when it comes to the rehab process. Because I'm like, okay, you know what? Yesterday wasn't as bad as I thought it was. Let's get to work today. Yeah. Like, do you, in your leadership role, right? So when we're talking, let's transition from being a practitioner to leadership. Does that change? The mentality of finding small wins change when you're trying to elevate the group around you?
Well, I think you put it really well. Is like you have to know the people, and it doesn't matter if it's the athlete. It doesn't matter if it's a coworker or colleague. At the end of the day, it's about people. It's about what they care about, what they enjoy, and what brings value in their life. And so if I'm an athlete, that may be a little bit different. If I'm a coworker, that may be a little bit different. But if we can figure out what those things are and really know these people and not assume, I think that was one of the we talk about things that I was surprised about in working in pro sports. I guess I just assumed like sport was the number one most important thing for these people all the time. And it is important, but, most of them, many of them are very proud to be husbands and fathers and business owners and, members of the community. So figuring out really what they like, who they are, and what kind of makes them tick, I think is really important.
There's a phrase my mother used to say, shout out Mom L, by the way. Yeah. That's her license plate, Mom L. It's amazing.
Excellent. I hope she couldn't put your whole last name on the license plate.
Yeah, well, y'all can really do well on a license plate. Like Mom L or like Mrs. L always work. Well, Mom L always say, like, don't assume because you make an ass out of a human being.
Yep.
Right? And so you said it great because there's so much more to their identity than just being the player. And I think outside looking in, right, things you learn working with professional athletes and working in sports, like they met me just playing the sport because God gave them gifts, maybe body type, but I think NBA players, if you're 7 foot tall, pretty likely you're going to be in the NBA. So
sure.
Give them those gifts. Yeah, you have talent, right? There's things that you can't teach, and some guys have it. So I've been in situations I've noticed and heard from other players, yeah, he's playing the sport because that's what he's good at in life. Doesn't necessarily enjoy it wholeheartedly. He actually enjoys cooking. Yep. That's his passion. But I think some athletes realize, you know what? I'm good at this. There's a timestamp on this. There is an expiration on this career, and that typically goes into, we're starting to see mid to late 30s now, which is wonderful. Right. So I think this idea that there's so much more to the athletes we work with, and even the staff that we work with too. It's not just about the pro sports that we work in. Like, yes, it's great, but there's a lot of hard work that goes into everything, and also so much more that goes into helping everybody finding their small win, and understanding, like you said, knowing your people the best helps us do that.
And I think, highlighting some of the work that you're doing and other folks who have podcasts and people who have, social media accounts that are focused on education or whatever they are, I think it would be very easy for somebody like you who has a very intensive career and job commitment to say, hey, this is me, this is my life, this is my identity, and that's okay. But there is so much more as well. And if we can step back and look and say, all right, we've got this, we have all the work that he's doing professionally and to promote, the profession and this larger group of people, and then obviously everything in your personal life too, it's pretty amazing.
I appreciate that. Thank you. It took a lot of courage to get here and do this because, like you said, like I thought big part of my identity was, hey, like I work in pro sports, and you go home, right? You go home to see your friends and family. Oh man, like how's it to work in pro sports? Like, oh, that must be so cool. And you constantly have this positive reinforcement from those around you that you think, oh, my life is great, my life is good. But don't get me wrong, like there's struggling days for us. Like, right, the travel, the constant missing of holidays, the constant don't know what your schedule is until midnight the night before, possibly, right? Like the idea, like my mother still cannot wrap her head around, hey, like, so like Christmas, what's the plan? Mom, it's October. I'll let you know on Christmas Eve. So like it takes a while, it takes some courage to start doing it. But what I've noticed about myself is it keeps the ball rolling elsewhere. We find it's like a snowball going down the hill. Like once you start rolling, like not only does like what we're doing here, educating and trying to bring awareness to many topics that we talked about, but like I've noticed improvements elsewhere in life, right? You got to start doing it. You just got to go for it, which I think has been a huge blessing in disguise for me as well.
Yeah. Have you felt any of the imposter syndrome or anything like that, especially, maybe hopping into kind of this podcast space?
100%. 100%. Like I was joking with my colleague and friend Corey, and I said, after we did the first episode a few weeks ago, he said, how'd it go? I go, oh shit. Like I was like, it is like, I thought I was like so confident, gonna go in and I could deal with someone that I know very well. And I thought I'd be more comfortable, but being on the other end, like it's a struggle, right? But just like, right, we tie this back to the athletes. Like you just got to get past day one, right? You just got to put one foot in front of the other. You just got to do it. The more repetitions you get, the better you'll do. Like you got, the way I view it, I'm flexing a different muscle, right? Flexing a different muscle and growing. And sure, like I still don't know what I'm doing half the time in this space, but like unless I do it, I'm not going to learn from it. I'm not going to grow. So I think giving myself some grace and giving the space to say, hey, you're not going to be great at this from the jump. You probably be bad at this from the jump, but it's okay to push forward and learn from it and just understand, just be one step better the next day. Like be 1% better the next day. Can you do that next episode? Can you do that in your training, in your rehab? And I think taking that mentality, a lot of the lessons that and a lot of the speeches we give to our athletes, I got to remind myself, you know what? Take a page out of your own book, right? Like finding small wins. An athlete tweeted, put that on an IG recently. I like, you know what? That was a great pep talk you gave it. I'm like, I like that. So certainly feel the imposter, but I think over time, I hope it starts to dwindle as we do this more often.
Yeah, that's a good point. And for me, like expectations that we have for ourselves and others, like I would never expect somebody to be able to do a new skill without practicing. And that's, what podcast, flexing a different muscle. This is a new skill. It's skill acquisition. Like you think about it as a kid, like you wouldn't be like, oh, let's put this little kid on the bike and he can't just go and like ride a mountain bike course. Like, why do we expect those things out of ourselves as adults right away?
Because we hold ourselves to a higher standard. And I think we just think more of ourselves or think more of what other people think about us, when in actuality, if you ask them, they're like, nah, like, I'm cool with that. Like, I think there's a little bit maybe too like a hypervigilance or hyper-analysis of who we are and what we do. I think that's probably a friction point for some people, including myself. Others, I'm envious of the people that can just, I don't care, I'm just going to be me. Like I can do that. In certain situations, it's wonderful. In certain situations, probably get you in trouble sometimes. Sure, want to stop and think for a few. But it just helps me remind myself that, like it is a journey and it is a process like anything else that we do in life. I don't think it's going to be easy. It's got to be hard. A coach I know loves to say everything you want on the other side of hard. Yep. And so I love that expression. And I think that's just how you got to push forward.
I like that. That's exciting. It's invigorating. Let's go.
Last question I want to dive back in with you.
Sure.
With Ben, because we talked about it a little bit, and I want to bring it back to it, was context of the whole person and the athlete.
It's okay.
And there's a big push in society now for longevity. The world of longevity. And I'm seeing like common practices that we used to do in sports and medicine starting pushed out. For example, like we're not shooting up guys with Toradol as much anymore. Right, we're being a little bit more cognizant of how much medication we are prescribing because we're seeing the rebound effects in life down the road. Right, within player healthcare and performance, how do you view longevity, and is there a space for longevity tactics in the world of professional sports?
Yeah, I think that's so important, and we're seeing that across the board, like you talked about, related to medications, related to joint health, related to mental health, quality of life after pro sports. Interestingly, and this is where the whole hip thing comes back in, and kind of what I'm most interested in, we've seen this, big spike in things like, FAI or I have hip impingement. And now a lot of the research in that space is saying, hey, between the ages of 9 and 13 years old, that's where those bony changes are really starting to occur. So I think we need to reframe what longevity looks like. And I think it's from the very beginning of being an active person all the way through the end of a career if they go into being a professional athlete. But I'm excited to see how some of that reframes, because there's obviously a conflict between, hey, I want to acquire skill, get really, really good at something, start really early and become a pro, but also knowing that we're humans, not robots, so we have physical limitations, and how do you marry those two seemingly competing interests at time together?
And that's the biggest struggle. It's the biggest challenge. The healthy athlete's an oxymoron to me. Like we say, oh, the guy's healthy, he's good to go. But let's zoom out here. Like, let's define health. And playing 4 games in 4 different cities in 7 days is not healthy. Yeah, they're playing and they're being successful out there. But I think if you were to take a peek under a microscope, they might not be as healthy as they would define. So I find it fascinating. It's honestly an interest of mine, trying to figure out personally, but also just learning from those in the space, like how can we elevate the practices and the integration of disciplines, because we're starting to see more people be qualified in different disciplines. I think you're starting to see more of the dual credential. You're starting to see more of those, even just, maybe not even dual credential, but going on and going to learn more, because you know what? I think this is beautiful and I enjoy this. So I'm going to go learn about it because we have YouTube University now, right? You can learn literally anything. I just found out about YouTube University. Side out last week, one of the players told me about, like, this world is too much. You don't even need a college degree. You just need YouTube.
Wikipedia.
So we digress back to the original point of how do you feel we can elevate and integrate some of these practices and the medicine of longevity and the theory of longevity into the healthcare of athletes?
Yeah. It's a big question. I guess, there's the point that we have them, which is such a small period of their grand scheme of their life. I wonder what we can do for life after sport. I've wondered about that a lot, like, within leagues or outside of leagues. Like, I know the NFL is doing some work in this space, and there's probably a lot of other professional leagues that are doing this that I don't know about. But, after they are retired or done playing at 30 or, whatever age it is, what do we have set up for them to continue their health and well-being after that? And then, to your point in your original question, prior to that, how can we help them by doing things like, advocating for them, by taking away some of the medications or prescribing them less that we know have long-term health effects, and continuing, I think, just to learn and try to get better at what we're doing. But also, I think informed risk and education is important for these athletes. Them really understanding, hey, for the long-term health of your knee, a meniscal repair is probably going to give you a better outcome when we look at osteoarthritis rates. However, I know you have a really important game and you're in a contract year and you want to make a decision based off of those bigger factors, but at least educating them and giving them the opportunity to say, yes, I heard this, I understand what this means, this is a risk I want to assume for these other reasons, but at least give them that information and don't make those decisions for them.
Very underrated and great points you bring up about educating them on what their options are. Because I think my experience has been that imagine now the present day athlete, especially the college system has been, and NIL deals coming through, right? Even like the AAU systems and basketball, and then the academy systems in soccer. Like the overarching like thought that comes to mind is these guys have been told where to be and what to do since they were probably 10 years old in some instances, especially in the soccer world if you're in the academy system, right? So I think when it gets to our level and we're trying, they're young men or women and trying to decide, what do I do? I think you said it perfectly, is we have to educate them in the sense of, hey, here's what this is going to do now for you, but also be aware, like long-term, this is what could happen. And granted, the context of, like you said, contracts play a role, age of the career plays a role, but ultimately where my mind goes in trying to and bestow this longevity idea amongst these athletes is thinking beyond just the next game in this season. And you have to educate them and provide them choices ultimately. Because I think we forget that if we were on the outside of pro sports or teams, you probably go see 2 or 3 people to get an opinion and learn and educate before someone rather than one person saying, hey, I think you should do this, which may be the case in team settings when you're having those conversations and it's only coming from within. You could be missing out on other ideas or thoughts outside of y'all.
Yeah, and I think that the timing too is really interesting because everything is expedited and heightened in pro sports. The time between an acute injury and everything else, then it comes out after that, in the general public space. That may take a month, 6 weeks to see a provider, get an MRI, see the provider again, get the results, talk about next steps. In pro sports, that's a 24-hour process. A lot of times shorter than that. So being able to pump the brakes and say, hey, you have time to think about this. It is your body. It is your choice. You need to be comfortable with what is going on is really, really important.
The expression I say to athletes is let it breathe. Yeah. Like, because the other thing too, and the better they get, the more people are pulling on them, the more strings that are being pulled. So there's how many people are in their ear saying, hey, I think you should do this. Hey, like, have you gotten this information? Have you thought about this yet? Have you done this yet? And there's all these questions and it's overwhelming, not only from the outside for the athlete, but sports medicine performance staffs are growing. And it's very common in the NBA for a staff to be 10, 12 people. And everybody has good nature, coaches, staff. We want to help the athletes. Like, we want to be there for them. Everybody's asking questions. But I think, like you said, we have to take a step back and just let things breathe. And let's really think about things and give the athlete the space to process and understand what really is going on. Because if we rush to decisions and they're not making an informed choice, or they don't feel like they're making the decision that they want, and then ultimately, when and if things, shit hits the fan, they may be pointing the finger and say, well, you guys told me I should do this. I didn't want to do this. So I always think it's important to, as part of the process, is having the athlete be informed and educated and be willing to say, this is what I want to do. And it may be different than what you were recommending, or maybe different than what I'm recommending. I think we have to be okay with that and acknowledge that if this is what they believe in, because we know the power of belief in something, right? If you believe in it, it may come to fruition and you may be more committed to it. So I think it's so important that we continue to do that rather than just telling them what they should or shouldn't do.
Right. Yeah, I think absolutely. So we've got to give them the space. We've got to give them the education, and we need to create that environment too. And that can be really hard. You can control what you can control, but there are a lot of outside factors like you outlined. Like, if you have a coach who's much more authoritarian, then maybe that kind of bleeds down into everything else. But I think being able to kind of pull away from that a little bit, create an environment where they know that, hey, we are all on your side and have your best interest in heart, and ultimately are here to support the decisions that you are choosing. And like you said, they may not be the ones that we choose, and that's fine. It's not our choice. It's not our body.
100% is not our choice, not our body. That is amen to that one. All right, let's wrap this up here. Have some quick hit questions for you. All right. We're going to say first word that comes to mind. Are you ready for it?
One word.
One word. See, and you got maybe a 1.6 second time limit to answer.
Okay.
You ready?
Yep.
The vibe of a locker room after a win.
Energetic. That was too slow for the buzzer.
That's like Stacey Hardin from Damn It, No, but too late.
Okay. All right, again.
All right. The key to successful rehab is
Collaboration.
leadership. All comes down to
Caring.
I love that. One thing women do better than that.
Multitask. Quick. That was the quickest.
My wife will be staring at me like, yep, you can't do more than one thing at once.
Check. And I would say it's a one-word answer, but meaningfully multitask. Like, have you ever seen a woman breastfeed? Like, the ways that women can mother and do other things is fascinating. Like, absolutely fascinating.
Once you throw motherhood into it, it changes the game. Like the perspective of, like you said, what women accomplish. I love the quote by Betty White. She says, what is the quote that she says? Man, I'll have to go. We're gonna have to go back to that.
Okay.
I'm gonna text you later on because it's great. It's a great quote, but I feel it's something to do with female versus male parts. It's wonderful. Yeah. The way to be successful in sport is
Flexibility.
Amen to that. Let's just dive quick deep into that. Why is flexibility so important in sport?
I mean, so you talk about kind of the sports medicine, sports performance realm. One of the things I love about it is it's part art and part science. So you have the science, you have the literature, you have the support. We've talked before about some of the cons of the process of scientific literature and just related to the timing. However, it is still very, very important and part of that. But then you have the art part as well. And so that's the humans, as the humans, not robots. And I think it's such a cool space to be in where you are able to meld both of those. But you have to be flexible on both ends too. If something comes out in the literature, and ice is kind of like the biggest, easiest one to point to, where it may change your beliefs or it may change things that you read. And you have to be willing to challenge your own thinking and the own information that you know. And you have to be able to do that in the science realm, and you have to be able to do it in the personal realm too, the art and the science together.
Perfect. Love that. Well, thank you for coming down here, Seth.
Of course.
This was wonderful.
Yeah.
We got a nice little setup here in the hotel room. It's wonderful.
Yeah. This is really nice.